Transient ischemic attacks, which is also referred to as TIAs, are considered a mini-stroke that is essentially a warning sign that could indicate a more serious stroke could happen in the future. Thankfully, TIAs do not have lasting effects, but it's important to seek medical help as soon as possible to avoid the long-term effects of a full-blown stroke. About 1 in 3 people who have a transient ischemic attack will eventually have a stroke, with about half occurring within a year after the initial TIA. It is important to recognize the signs and symptoms of a stroke. Symptoms can include sudden weakness, numbness, or paralysis in facial muscles, arm, or leg, often in one side of the body. Sudden impairment in understanding speech, slurred or garbled speech, sudden blindness or double vision, dizziness, impaired balance, or disturbed consciousness. An easy way to know if you're experiencing a TIA is via a mnemonic phrase known as FAST. F stands for facial drooping or numbness, especially on one side. A stands for arm weakness. S stands for slurred speech or difficulty speaking. And lastly, T stands for time. Call 911 quickly. The symptoms themselves are brief, lasting usually 30 minutes or less.
TIAs are caused by a buildup of cholesterol containing fatty deposit called plaque, or atherosclerosis, and they accumulate in an artery or one of its branches that supplies oxygen and nutrients to your brain. In simpler terms, the blood supply to the brain is blocked or reduced briefly, often by a blood clot. TIAs occur in the same area of the brain as an ischemic stroke, which is more serious and has more detrimental effects. There are ways for you to personally prevent a TIA from occurring by living a healthy lifestyle, which involves eating healthy foods, exercising regularly, abstaining from smoking and using illicit drugs, and lastly, limiting heavy alcohol consumption. All of these will help to avoid this potentially life-threatening event. However, some people are more prone to experiencing TIAs. If you have a family history, are over the age of 55, a male, or of African American descent, puts you at a higher risk of having a TIA.
As the stroke program manager at Inspira Medical Center in Vineland, New Jersey, I interact and educate patients on the effects of their stroke and what kind of disability they can expect as a result of the stroke that has occurred. One of the key factors to prevent another stroke from occurring is to identify personal risk factors and the modification of those risk factors. One of my main roles, though, is to educate the community on the signs and symptoms and the importance of calling 911 immediately if they feel that they are suffering a stroke. My role in educating patients that have experienced a stroke is to determine which services are needed following their change in cognition. Some of these include physical therapy, occupational therapy, and speech and language therapy. To prevent a more serious stroke from occurring, you should schedule regular doctor's appointments, avoid smoking, limit cholesterol and fat intake, eat plenty of fruits and vegetables, limit sodium intake, and maintain a healthy weight. While TIA symptoms are short-term, you could experience long-term effects if you experience a hemorrhagic or ischemic stroke, which can significantly affect your motor and language skills. Remember, if you think you are experiencing a TIA, think fast and seek medical attention immediately.